Today at our media advisory on this Tuesday, I'd like to welcome Jason Thorne, our Emergency Operations Center Director, Dr. Elizabeth Richardson, our Medical Officer of Health, new guest, Edward John, of our Housing Services Director, and returning guests, Melissa Farrell, of the President of St. Joseph's Healthcare Hamilton, and Rob McIsaac, President and CEO of Hamilton Health Sciences, and returning as well, Dr. Scott Wooder, Lead Physician, Hamilton Family Health Team. And today we are joined by these key care partners and city leads who have been on the front lines of our response and will share what each area is doing to support the ongoing efforts related to the pandemic. The resources needed to address the ongoing pandemic continues to evolve, and we remain absolutely committed to continuing to work with our partners across the city to save lives and keep people safe. So I'm asking everyone to be as patient and kind with one another as you can be and follow all of the public health measures in place, including the very important getting vaccinated. And we know that that vaccination continues to be critical to the fight against COVID-19, and we are committed to getting as many COVID-19 vaccines into arms as possible, and we have mobilized additional human resources to support vaccine clinics in our city. So there are ample appointments available and walk-in opportunities as well at specific locations across the city for boosters, for first and second doses, and pediatric vaccines. So the community members, you can learn about those available locations and hours of operation and how to book at www.hamilton.ca/get-your-vaccine. And I know that Dr. Richardson will have some updates on that issue as well. So please think of others and stay home as much as you can. I think the snowstorm certainly encouraged a lot of that. But if you're not feeling well, stay home. And I know the doctor will talk about those issues as well. It's critical for everyone to continue to follow public health guidelines to reduce the spread of COVID-19 and the variants. And you know what you need to do, and we certainly encourage you to continue to do them. For businesses and patrons, please continue to follow the regulations in place. Each measure is in place to ensure to blunt the spread of COVID-19 and the Omicron variant that is still very much out there. So let me now pass it on to our great Emergency Operations Director, Jason Thorne, for some updates on impacts in our city. Jason?
Thank you very much, Mr. Mayor. And I know we have a number of speakers here this afternoon, so I'll be very brief in my update remarks from the Emergency Operations Center. As was noted previously, we remain in step 2 of the province's roadmap to reopen, and that will remain in place until at least Wednesday, January the 26th. So that step in the roadmap does include a number of restrictions, and a full list of those are available up on the city's website. From a city service standpoint, we continue to monitor the impacts of any staffing shortages due to redeployments. As mentioned last week, 245 city staff have been redeployed to directly support the frontline vaccination clinics. We're also monitoring the impacts of any staffing shortages due to isolation requirements, illness, quarantine periods. 164 city employees have tested positive for COVID-19 or are in isolation as of Monday of this week. As of today, 23 of our paramedic staff have either tested positive or are in isolation. These absentee rates for paramedics are slightly higher than normal for this time of year, but thanks to staff taking on extra shifts, overtime, canceling some of the pre-scheduled vacation, we've been able to maintain our normal service levels from paramedics. The staffing challenges to city services do continue to be monitored, and will be continue to communicate any impacts they have. One of those is HSR. As I reported last week, HSR will be implementing a new schedule starting Sunday, January the 23rd, and that's going to run up until Saturday, April the 30th. 18 of our routes will have their frequencies reduced to generally to a summer level of service. In general, the routes being reduced are only impacted in the peak, and generally that means going from about a 15-minute service to about a 20-minute service. No routes are being canceled, and the regular hours of operation Monday through Friday will remain in effect. Our customers are encouraged to download our HSR Now app, monitor our social media channels to have the latest updates in terms of our transit schedules. And lastly, in long-term care, as of today, approximately 5% of our staff between Macassa and Wentworth Lodge are off sick or are isolating. So these staffing levels are stable. And again, thanks to the support of our casual team members, staff working overtime, some of the redeployed staff, we have been able to maintain our service levels in our long-term care facilities, and we do have additional contingency plans in place if needed. So with that brief update, I will turn things over to Dr. Richardson.
Thanks very much, Jason. So the situation here in Hamilton and across Ontario when it comes to COVID-19 does continue to be of great concern, particularly around the number of people who are having severe consequences from COVID-19 requiring hospitalization, and of course the strain that that is putting on our healthcare system. So I'm very glad our healthcare partners are here to speak to these challenges. We are monitoring our key health indicators closely to identify when Hamilton has reached a peak or a plateau in the surge of cases related to this Omicron variant, and currently it's still too early to make any declaration around that. Our testing eligibility, of course, is prioritized for those vulnerable populations and workers and their households. And so we are going to continue to talk about mainly hospitalizations, ICU admissions, and deaths, as well as the number and size of outbreaks that are happening as we track this along. To that end, the average daily number of new hospitalizations and ICU admissions remains high. There are approximately 10 new hospital admissions each day on average amongst Hamiltonians, and more than 2 new ICU admissions each day. This is similar to what we've seen over the past week. The average number of deaths occurring each day is at 1 per day. We do know this is a lagging indicator, and so we have seen this come up somewhat in the last few days, and we'll continue to track that closely. As seen in our recently published ICIS data, our rate of percent positives amongst tests that are being done is sitting at 26.8% for the PCR tests that have been completed, and that will be updated on our dashboard tomorrow. Currently, there are 96 active outbreaks, with 3 new outbreaks being added yesterday and 3 having been declared over. As you know, since December 23rd, we have been focusing on vulnerable settings such as hospitals, long-term care homes, supportive housing, shelter system settings, and other settings where there are the most vulnerable in our community. And of course, details on all of those outbreaks can be found on our webpage. Yesterday's winter storm did impact our vaccine administration here in Hamilton, as well as across the Greater Toronto and Hamilton area. All of our healthcare partner clinics today are operating as per usual, and anybody who was unable to receive a vaccination yesterday due to the storm, they can walk into the Centre on Barton for their 3rd dose, or if they were looking for a booked appointment, they can rebook those appointments through Hamilton's booking tool at www.hamilton.ca/getyourvaccine. Staff did reach out to impacted community members yesterday to provide them with options, including rebooking. There are many appointments available, as the mayor said, and we do thank those community members who did brave the weather and come out to their vaccine appointments, along with all of our staff who managed to get out and make sure there was somebody there to receive them when they came for their vaccines. We know that Mother Nature had, of course, other ideas as well when it came to getting kids back to school on Monday, and that's given our teachers and a little bit more time perhaps to prepare for return to in-learning. A big thank you to all of the school board staff, all of the teachers for everything they're doing to have people back in school, kids back in school. And I want to also acknowledge our childcare programs here in Hamilton that have remained open throughout. We know that childcare settings are very important spaces for learning and child development, and of course, a critical support for our frontline workers. And so there are multiple infection prevention control measures that are in place for both staff and children in those childcare settings. And they've done a tremendous job at adhering to guidance and limiting transmission. So as we are keenly happy to have kids getting back to class, do just want to acknowledge the enhanced infection prevention and control measures that are available for schools, including the provision of rapid antigen tests and masks for students and staff, the deployment of the additional HUPA filter units, and the updated screening requirements, as well as continuing to pause high contact extracurricular sports. Very important, though, as we think of those additional measures, that we stick by the core measures that have worked all the way through. And so again, remembering that students need to complete the daily screening for symptoms and validate the results once they arrive at school, to maintain a physical distance, to wear a well-fitting mask, and to practice good hand hygiene. We know as well that in the hallways and lunchrooms that school staff need to be vigilant in terms of interacting with their peers and making sure that physical distance is maintained from students, as well as appropriate PPE being worn. And finally, of course, it is absolutely critical when we're dealing with this Omicron variant that is easily spread, that people stay home when they are ill, whether they're staff or students. As we work to learn to live with the Omicron variant and COVID more generally, increasing vaccination rates continues to be a key piece of helping to balance the risks between transmission and the risks related to the pandemic itself, as well as all of the control measures and the effects it's had on our mental and physical health. So for children who are 5 to 11 years of age, we have seen a steady uptake in demand for a first dose of COVID-19 vaccine since the beginning of 2022, we're happy to report. And as of this past Sunday, the 7-day average of first doses has risen to 300 per day. This is up from the 212 per day that had been in place previously. In total, we're sitting at 46.3% of children 5 to 11 years of age having received a first dose of a COVID-19 vaccine, and nearly 10% now have become fully vaccinated. We are going to be working, we have been working with our local school boards to talk about school-based vaccine clinics and promote the availability of walk-ins and other community clinics. We have had 3 clinics that are right nearby during the day, several of our schools in our highest risk areas of the city. And so we are looking at whether there are other opportunities which will help us to increase vaccine coverage in our community. When we look at all ages, over 86.1% of everybody from 5 and up in Hamilton has received a vaccine to date, and 80.9% are fully vaccinated. On the third dose front, we've now administered 247,000 booster vaccines, and 55% of those that are eligible as of January the 13th have been vaccinated. So knowing that this is a very important tool, all of the healthcare partners are continuing to look at how we can evolve the vaccine program. And so you'll know that we did, in order to provide easy access, open the Center on Barton Vaccine Clinic as of this past Saturday to walk-ins for anybody who is 18 and over to receive a third dose of the vaccine, as well as those that are already open for first and second doses. And I'm pleased to say that as of tomorrow, the Mountain Vaccine Clinic at Lime Ridge Mall will also begin offering third dose walk-ins for community members 18 years of age and over, as long as it's been 3 months since their last dose. As I said, there are now openings for walk-ins for our first and second doses at many of our clinics, including Center on Barton, the Mountain Vaccine Clinic at Lime Ridge Mall, the physician-led clinic at David Braley Health Science Center for those 5 and over. Our third doses for pregnant individuals and their families can also be accessed via walk-in at many local clinics. And we know this age group is particularly important, both for the moms who are at higher risk of severe consequences, but also for their babies who are at risk of severe consequences and can be protected by the antibodies that are produced when the mother gets vaccinated, and those can be transitioned over and protect her newborn child. So very important that our pregnant women in our communities are talking with their healthcare providers about it and coming out for their first appointments. As I said, all these appointments could be booked through the www.hamilton.ca/getyourvaccine website. And of course, you're also encouraged to check with local pharmacies who are also offering all of these vaccines. So with that, I'm going to turn it over to you, Edward.
Thank you, Dr. Richardson. I'm Edward John, Director of Housing Services here at the City of Hamilton. Hamilton's homelessness system is under considerable pressure during this wave of the pandemic. The rising cases and outbreaks in the system has exacerbated our system-wide staffing pressures, not unlike that of our healthcare partners. In addition, the winter and cold weather further creates challenges across the system as we are operating at or near capacity, and there are limited spaces available. The safety of our clients and staff is a top priority, and we continue to adapt and evolve our response to accommodate as many people as possible inside. Housing Services continue to closely monitor shelter capacity and enact contingency plans to protect and maintain the operation of spaces and further increase capacity in the system where possible. Notwithstanding the immense staffing pressures across the system, we continue to maintain and operate the system at full capacity due to the support and dedication of our funded agencies. Over the past week, we have been able to work with our shelter providers and public health colleagues to increase the capacity with the system by 17 beds, with the potential for further increases, which given current staffing shortages has been instrumental. However, we continue to recognize that access remains a challenge. With the ongoing outbreaks across the system, our shelters are doing their best to isolate people in situ and enable individuals to be admitted where space and staffing permit, in an effort to balance and mitigate the risks to individuals of being outside and also risks to COVID-19. The city's winter response for the homelessness system will continue to evolve and may include additional and extended options outside of cold alerts. However, this is currently based on available resources such as staffing and funding, as well as the impacts of the fourth wave as they lessen. The city continues to invest in the expansion of emergency shelter accommodations and drop-in programs in response to community needs as a result of the pandemic, while in parallel working to transform the homelessness serving system towards a more responsive, resilient, and sustainable housing-focused system. Since the start of the pandemic, additional investments have enabled the temporary expansion of shelter space across the system, plus additional overflow space, as well as a new temporary women's shelter operated by Mission Services. Though once again, we recognize that access remains a challenge. In addition, investments have been made directed towards community drop-in programs to expand and maintain services for vulnerable residents, including meals, showers, harm reduction supplies, and overnight access to drop-in services. These include the investments in the Wesley Day Center, the YWCA's Caroline's overnight drop-in space for women, Mission Services Willows Place daytime drop-in for women, and youth drop-in at Living Rock. Recently, investments in the hub for extended hours during cold alerts and the extension of overnight drop-ins Sunday evening when the storm began. Our response also includes the 7-day per week outreach of engagement of unsheltered individuals by the city's housing-focused street outreach team, who continue to engage unsheltered residents no matter their circumstances, to connect them with shelter spaces, drop-ins, develop housing plans, and access to other resources within the community. I do want to do a heartfelt thank you to all staff, agency partners, and their staff for the flexibility and nimbleness during this incredibly challenging period. And with that, I will hand it over to Melissa Farrell, President of St. Joseph's Health Care Hamilton. Melissa, over to you.
Thanks, Edward. Really important updates too. I did want to talk about the current situation at St. Joe's, and I know Rob will be speaking after me about the situation at HHS. And as you can appreciate, they're very similar in some ways. The truth is the next few weeks at St. Joe's will continue to be some of the most challenging we've experienced during the pandemic. We're really feeling the impact of the high community transmission more than ever. At the moment, we have 93 patients with active COVID in our hospital, and about 60% of those are those that have been admitted for COVID. Our ICU is completely full. Half of those patients being cared for are COVID positive as well. We're looking at all avenues to increase and surge, not necessarily in the most ideal spaces either. We are operating at very high capacity on the acute side and caring for patients who are very ill, some of who would typically be cared for in the ICU. The situation for time-sensitive urgent and emergency care is precarious, really because of the high demand for critical care and acute care beds. Last week, it really felt like the issue was more connected to our healthcare workers, and with so many healthcare workers sick, this week it really feels like it's 50-50. It's about the occupancy that we're seeing inside the organization, as well as the high demand that we have based on the fact that we have had so many staff off sick. We're managing 5 outbreaks across the organization right now. We have nearly 170, so 169 of our staff and physicians today that are isolating at home with COVID. And we've had over nearly, 700 staff who have tested positive since the beginning of this wave. The number, this 169, is thankfully lower today than it was last week, but it's still very high. And we've really had to take many measures to ensure we have enough staff to keep our essential and critical services going. This means we've looked at redeployment, both voluntary and mandatory. It's one of the strategies that we've used. This includes both clinical and non-clinical staff. We have turned to voluntary physician redeployment to support nursing. We've also brought back retired staff to assist in areas such as the vaccine clinic. We've discharged all patients who we believe can safely recover at home. We've adopted different models of care where we are short-staffed. We've paused vacation requests. And today, for the first time ever, we've had to reduce the hours at our East End Urgent Care Center to redeploy staff and physicians to our Charlton acute care site. All this puts added pressure on our healthcare workers who are already tired and feeling the strain of this long pandemic. And I just want to say my admiration, I know others are going to join me, for our staff and physicians who just continue to do the very best in these circumstances. I think we're all really worried for them. We know we aren't operating in normal circumstances or in a sustainable way. We really want to thank the community for your continued support and understanding during these incredibly challenging times for us. So I'm going to turn it over to Rob.
Yeah, thanks very much, Melissa. And I think the story for Hamilton Health Sciences is actually remarkably similar to the story that Melissa just told for St. Joe's. Few minor differences, which you might expect, but we have 162 COVID cases in our hospital as of today. Just under 40% of those would be people who were admitted because of COVID. Others were admitted for other reasons or possibly would have contracted the virus in the hospital. We have 20 patients with COVID in our ICUs. Unvaccinated or partially vaccinated patients continue to make up a disproportionate number of the patients at HHS. There are very high occupancy levels across our hospital system. Our ICU is completely full at 101%. Of our funded beds, we are seeing 112% occupancy, so we are definitely over capacity. As a result, the state of hospital care in Hamilton and our region remains precarious. We are all doing what we can to maintain our most critical services. In many cases, we're having to do it through extraordinary measures like ramping down surgeries, ramping down procedures, redeploying both staff and physicians, as was previously mentioned, and temporary closures of some of our facilities. Having said all of that, we are doing our utmost to continue to perform the procedures and the surgeries and the treatments that are urgent and emergent for people both here in the city and in the region. All of which is to say that, well, people frequently hear that this variant is mild, but we can attest to the fact that for some in our facilities, it is indeed very serious, and we continue to see hospitalizations because of it. Just to flesh out a little, at HHS, the majority of patients admitted due to COVID are unvaccinated, and in the ICU, about 1/3 of our patients whose primary diagnosis is COVID are fully vaccinated, so 2/3 are not. The community can best help us by following very extensive list of public health guidance that Dr. Richardson previously enumerated, and also by seeking care in an appropriate setting. There are a number of healthcare options available in the community, which we would strongly encourage people to seek out prior to coming to an emergency department. Individuals with conditions that don't require immediate medical attention should first contact their family doctor. We'd also encourage people to go to needadoc.ca. That's a website which provides healthcare options for people seeking care here in Hamilton. So I will leave it at that and pass it over to Dr. Wooder.
Sorry, you'd think I'd have figured the mute out by now after all this time. Thank you very much, Rob. Just before we started this call, somebody reminded us that it's been 2 years or almost 2 years since our community faced COVID, and it's been an awfully long 2 years. But there's a lot of things we've learned about ourselves over that time. And as frustrating as it's been, I think we can be very proud of how we've reacted to the pandemic. A lot of things have been asked of individual citizens, been asked to maintain safe distance, to avoid unnecessary gatherings. We've been asked to wear masks, and we've been asked to get vaccinated. And people have responded very well to those things. Now, we're asking something else of you, that you seek care at the best place so that our hospital systems aren't overwhelmed. And you've heard from both Rob and Melissa how precarious the situation is in the hospitals right now. So it's in all of our interest to do what we can to keep those facilities from being overwhelmed. Now, there are times when you do need to go to the emergency room. If you think you're having a heart attack or a stroke, if you're struggling to breathe, if you have an emergency like that, you need to go to the hospital. There's no other place where you can get help. But many times, it's better to get care in other places. So for a lot of mild illnesses or mild symptoms of COVID, we can actually look after ourselves at home without any help from any doctor or nurse. We've all done this for years, and nothing has changed because of COVID. So just a reminder that for mild cold symptoms, get rest, sleep, drink lots of fluids, take care of yourself at home. If your symptoms are more serious, or even if you're not sure what to do, first thing you should do is call your family doctor or a nurse practitioner. You'll be given advice after a virtual visit, or you might be given an in-person appointment. If you have COVID or you're presumed to have COVID, you may be monitored at home for a week to 10 days. And that would comprise a health professional giving you a call at home every couple of days. You may need an oximeter, something that measures your oxygen level. And some people, of course, will be referred for more urgent in-person assessments. And the hospitals and primary care communities have set up a really good system to give people that type of care. Now, if you don't have a family physician or other primary care provider, or you can't reach your family physician, you can arrange for a virtual visit at urgentcareontario.ca. urgentcareontario.ca. And Rob's already mentioned the outstanding website, NeedADoc.ca. And there you'll find a lot of information about how you can get help outside of the hospital. Family medicine community in Hamilton has developed the website hfam.ca. That's hfam.ca. It's primarily aimed at family physicians as a clinical resource library, but there's a lot of very good information there for patients about self-care and what you can do to look after yourself and your family. Just to summarize, most people with COVID, they can be managed in their own homes, either through self-care or with the help of the family physician. Primary care providers in Hamilton, we're willing partners with our colleagues to help keep our hospitals free for the most seriously ill people. So I'd like to turn things back to Mayor Fred Eisenberger. Mr. Mayor.
Thank you very much, Dr. Witter, and all of the presenters, actually. Thank you for all of your very important information. And I know Hamiltonians are going to continue to be thoughtful about all the public health measures that help us manage this virus, and as well as Dr. Witter has pointed out, making the right choice in terms of where you get your health care. That will certainly streamline the process in every way, as Dr. Witter has mentioned, and certainly Rob McIsaac and others. There are good options out there for alternate healthcare that will help lighten the load on the entire system. So thank you so much for doing that. Keep up the good work in our broader community. And I know that that are a number of folks who are on the call right now that are anxious to ask questions. So I'm going to, without delay, turn it over to Jasmine Graham, and let's get the media questions rolling. Jasmine?
Great. Thank you so much, Mr. Mayor. We have 3 media joining us today. So as usual, we will start with one question and one follow-up for everyone. First question goes to Sarah Piesker from CBC Hamilton. Sarah, you can go ahead.
Hi there. Thanks everyone for this today. My first question is at the top of mind of a lot of people I've spoken to in the last few days, and it's about the return to school tomorrow. I'm wondering what you would advise parents, and this can maybe be for Dr. Richardson. What would you say to parents who are still feeling like maybe things aren't in place to protect their families from COVID when the kids go back to school tomorrow? And I'm also wondering if you would advise the school boards to continue monitoring COVID cases like some boards, such as the Viamon School Board, say they will be doing.
Thanks very much, Sarah, and good to have you here with us today. And so when it comes to return to school, I can totally appreciate that parents are trying to navigate through all of the information and the decisions that they need to go through, given what we've been doing for the past couple of years and understanding how things have changed with different variants and different vaccines and what they've meant for us. And so that's quite understandable that parents are going through trying to understand what they should do as they go forward. When we look at school, it really is an essential service. It really is something that's essential for the well-being of our children. And when we look at it broadly around what the risks are that we're trying to balance, we know very well that there are some risks to COVID-19, but there are also very significant risks from a mental health perspective, an academic perspective, a learning perspective with kids not being in school. And so that's why you hear the call that was made some time ago about schools being the first to open and the last to close because of their importance to our children and to our society more broadly. And so as you know, parents are going through looking at the information, considering it carefully in terms of what's right for them. You know, the schools have made efforts to make this as easy as possible for kids to come back to school, for parents to look at options as they come back into school and engage with parents to talk through those options. We think that's something that parents need to work through and make the decisions that best work for themselves. But we're very pleased to have kids coming back to school. In terms of reporting cases, you know, one of the things we need to remember is that testing isn't available now for any but those that are in the highest risk setting, as well as those that work in those settings. And so it's very difficult for people to know as we go forward exactly when there's somebody who is off ill that is due to COVID-19 or maybe off ill for other reasons. And so, you know, when what's been asked of schools is to report their absenteeism rate or their attendance rate at school as a measure of looking at how they're affected as we go forward. We do know some school boards, as you pointed out, have decided to report what is reported to them by parents in terms of RAT positive cases that children may have been tested for using the RAT tests that have been sent home, or they could report a PCR result if it is being reported to them by the parents. And so that's something for schools to work through in terms of what works best for them. I think, you know, what Dr. Wooder said during this, though, in terms of us moving forward and learning to live with COVID-19, we do need to start to think about this virus in terms of how we manage it as we go forward, and that ultimately we don't have tests available to all of us. We aren't going to know exactly where all those cases are and what is happening around us. And so how do we protect ourselves? And that's by using those public health measures. That's by getting vaccinated. That is by making sure we're doing the actions that we can take when we're showing up in those settings, making sure the screening is done, making sure that we keep our children or ourselves, if we work in those settings, home when we're sick. And so those are really the best ways to make sure that our kids are back in school, that they're in an environment that is as safe as it can be, and that we're also making sure that they have the best opportunities for their mental health and their academic development.
Can I go ahead with my follow-up? Is that
please do? Yes, thanks.
Great. My other question is sort of on a different tack. Is that allowed in this format? Does it have to be about my initial question?
No, you can go ahead.
Great. So I'm also wondering about the outbreak at the Barton Jail. It seems to have grown rapidly even since I last took a look at the numbers, and it's sometimes a bit opaque what's going on in the jail. So I was wondering what you at the city know about the conditions in the jail right now and what is being done to protect inmates. Thank you.
Thanks, Sarah. When it comes to the specifics of any outbreak, what's probably best for us to do is to follow up with you about that particular outbreak. The outbreak is by and large managed by the Ministry of Corrections and their staff who are in that setting. But if there's specific questions about that one, we can get back to you. We'll have somebody follow up.
Great. Thank you, Dr. Richardson. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for my question. My first question is for Hamilton Health Sciences and St. Joseph's Healthcare. The community is really looking for some transparency around the unprecedented transfers out of Ontario West. What parts of Ontario West have transferred these patients out, and how far did they go? Are they still in Ontario? Are they, 20 minutes away, or are they hours away?
Sorry, Joanne, I'm not familiar with transfers out of Ontario West. There have been transfers within Ontario West. Is that what you're referring to?
No, there has been 10 transfers out of Ontario West.
I don't think that's correct, but perhaps you and I could follow up offline.
Well, that's been reported daily. It's been St. Joseph's Healthcare. They're in charge of reporting the transfers, and they've been reporting the transfers to me, and their last count was 10. And an ICU doctor at Hamilton Health Sciences has also confirmed these transfers.
Yeah, no, I agree there have been transfers. I don't think they're out of Ontario West, but I don't know if we're debating terminology here or not.
It's my understanding too, Rob, that it's from Hamilton, Niagara, Haldeman, Brant, Burlington. So the transfers are from this previous Lynn region out into Ontario Health West, but we can confirm that it is 10.
Yeah, that's accurate.
Okay, Joanna, did you want to ask a follow-up question?
Yeah, I do. Yeah, thanks. There have been this one is for Dr. Richardson. There have been no infection prevention and control orders published despite the 96 outbreaks in high-risk settings right now, some with a high number of cases. Why aren't we seeing those orders as we have in other, in other waves of the pandemic? And how are you coping with such a high number of outbreaks among such vulnerable populations?
Thanks very much, Joanna. And as you say, a high number of outbreaks in such vulnerable populations. And so one of the things we're doing in terms of working with this is we have prioritized our response to these outbreaks that are happening in these settings. So we're not working on community-based outbreaks or workplace-based outbreaks as we were before. So our resources are instead focused on these settings. And we've also deployed more staff again to these this outbreak control work so that they can take the steps they need to do to assess those settings, work through, do the investigation, assess the settings, and check their IPAC measures, check the processes that they have in place, and give them guidance. And of course, our first step is always, if we see anything as we go through those measures with them, to provide further education about where there may be some changes they can make that would further help them. And as a last step, we do have the ability to write orders, and you did see us in previous waves need to write orders either around infection prevention and control or working with our hospital partners that are here to also step in and assist with outbreak management in those settings. So fortunately, with this wave, we have not needed to go that last step in terms of writing any orders when we're working with the homes and working through those issues, doing the investigations. We've not found any circumstances that have led us to require to write an order.
Great, thank you, Dr. Richardson. We'll go next to Tavia Morrow from the Hamilton Spectator. Tavia, you can go ahead.
Thanks very much. I think I'll ask Jason, could you just explain a little bit about the timing of the sort of the ramp, the lowered HSR service until the end of April? How was it decided until the end of April? And is there a chance that those plans might change depending on things go in the weeks to come?
Yes, thanks for the question, Tevia. So that basically represents one kind of scheduling block for transit. And the approach we've tried to take with transit is to not be in a situation where we are adjusting schedules on a week by week or every couple of week basis, where we're introducing service and then reducing service, because we do think it's very important to provide consistency and dependability for the riders and for the customers. So we want to set a schedule that has minimal reductions and have that be consistent for a period of time. So that's the reason for having it apply to a full scheduling block, and that is how HSR schedules out their service and schedules their drivers. That said, if we do have normal or close to normal staffing levels, what we can do and what we've done in the past is we can put supplementary service back on the road. So it becomes not necessarily additional scheduled route, but it does provide some additional service again on some of those peak routes. So that would be our first response if we are able to sort of maintain normal staffing levels, is to put that supplementary service out there. If that does become consistent, then we can look at doing some modified scheduling later out in the period. But again, the key was we want to make sure we are providing sort of a dependable and reliable level of service that customers could kind of plan around and count on.
I see. And Jasmine, maybe as a follow-up, Jason, I think you may have mentioned this last week, I can't remember, but can you give us a sense of the HSR staffing levels right now, generally?
Yes, I can. So generally, we're doing okay in terms of our staffing levels. We're maybe 10 or 15% above what our normal absenteeism would be in this period of time. So this time of year, we're normally in about a 40 to 50 people being off on some sort of absenteeism. So we're a little bit higher than that. But generally, we're staying close to what our staffing levels is, and like I said, the impact on the schedule is primarily just some reductions in peak level service. A lot of the times, what that means is instead of a bus coming every 15 minutes, it might be coming every 20.
Thanks very much.
Great, thanks, Jason. So we do have a bit more time. We'll go through for one more question each. I'll go back to Sarah first. If you'd like another question, Sarah, you can go ahead.
Sure, thank you very much. I've spoken in some other articles I've been doing lately. I've spoken to several researchers who say that the lack of PCR testing is making it really hard to study Omicron. And I'm just wondering, from public health's perspective, what challenges is the lack of or the absence of available tests and accurate case counts posing to your organization?
Thanks, Sarah. That's an interesting question, as we go forward, and particularly knowing that we, do a lot of research here at McMaster on these issues and work these issues through. So we're very glad to have all of that capacity locally. I think from a public health perspective, we want to see the evolution of the understanding of this virus, its severity, all of the dynamics that we know are in play with an infectious disease, so that we can understand what we need to do to control it. And of course, we always want the least measures possible that will bring us to effective control. So when it comes to PCR testing per se, as part of that, it is overall sort of not at this stage allowing us to look at exactly where we're at in the phase of the outbreak. But as Dr. Woodard pointed out before, we don't generally have that during influenza and many other respiratory viruses we go through. And so I think as we're learning to live with COVID and transition with it, one of the things is that we're going to have to figure out how to do surveillance with means other than having such widespread testing at this point. The other questions that would come to mind around, detecting variants, all of those things are likely to be able to be done globally, because we really are a global setting when it comes to COVID-19, able to be done with the testing that we have. So I'm not sure there's anything else from a public health perspective that would require us to have a broader sense of testing.
Great, thank you, Dr. Richardson. We'll go back to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks for the extra question. This question's for Dr. Richardson. Is anyone monitoring the staffing at the seniors' homes, group homes, assisted living, those types of settings that have very high numbers of outbreaks right now, coupled with, I'm assuming, similar absenteeism that other sectors are facing? Like, is there somebody keeping an eye on the situation in these homes?
Thanks, Joanna. So I think there's kind of a couple of questions related to that, or a couple of answers related to that, I guess I should say. So overall, these homes are generally regulated by a number of different organizations, whether it's the Ministry of Long-Term Care when it comes to long-term care homes. There's the Retirement Homes Regulatory Authority that relates to retirement homes. There are a number of different regulatory bodies that come into play when we're talking about these kinds of congregate settings, and all of them are acutely aware of the staffing issues when it comes to these homes and the challenges that they're facing. There is a set of guidance that is out there around returning people to work after they may have tested positive or when they're in isolation, and a whole risk framework for people being able to come back to work that those homes can apply through their own thinking through with their staff about what is needed and how they can help to make sure that there is an ability to provide service in those settings. There's also a group of people both within Hamilton at the HNHB level, the Old Lynn level as well, who are working with those congregate settings and supporting them, answering questions, and if it were needed, looking at where they might be able to get other staffing resources. Of course, those are in very limited supply across the province, but there's an active group of people that are there as a resource to these settings to look at how they can help them work through those kinds of challenges that they may have. And as well, when we're dealing with outbreaks, in those settings, we're talking with them, working through with them, what are the challenges that they face? If there are any challenges around staffing, we refer them into these groups or to working with their regulatory partner as well. And so I think there's many different levels at which that staffing level is being examined, and how everybody's working together to make sure that these homes can continue to be operated safely.
Great. Thank you, Dr. Richardson. We'll go back to Tavia Morrow. Tavia, if you'd like another question, you can go ahead.
Oh, thanks very much. I'll ask Edward. Edward, you mentioned 17 spaces were created, I think, in the past week, and I'm assuming that's, well, I'm not assuming anything. Can you specify if that's men or women? And you mentioned contingency plans. What could those be?
Thanks, Tavia. And just to confirm, yeah, so those were 17 beds made available through discussions with our public health colleagues. And so it is in the men's system that we're able to provide those additional spaces. We continue to actually look for opportunities for increasing shelter availability as a result of obviously the inclement weather and other pressures as the fourth wave kind of goes through our system. But once again, this is a system that is really under pressure from those staffing issues and the ability to provide as best we can those accommodations. So we continue to explore that. In terms of contingency measures, we speak to the ability for our shelter operators to remain open to admissions, even though they may be an outbreak, as well as the potential for them to increase their staffing either through funding directly from the city, and then last but not least, certainly the discussion of redeployment may be on the cards for those situations where it's warranted.
Thanks very much.
Thank you, Edward. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you very much, Jasmine, and thank you to our guest panelists today. Of course, Jason Thorne and Dr. Richardson, but Edward John of our Housing Division, Melissa Farrell, President of St. Joseph's Hamilton Healthcare, and Rob McIsaac, President and CEO of Hamilton Health Sciences, as well as Dr. Scott Woodard, Lead Physician with the Hamilton Family Health Team. All of you have shared some pretty important critical information and updates today, and we really appreciate you taking the time to share that with us and our broader community. Thank you. Thank you also to Jasmine and Bill Custers and the entire team at Cable 14 and Clear Cable. As was mentioned, this is the 120th broadcast media advisory that we've done to date in about 2 years of time. And just to announce that we will continue with weekly briefings for the next little while so that we can continue to keep everyone informed and provide these continuing updates as we struggle through the current wave of challenges that we're facing through the COVID pandemic. So thank you all for your ongoing participation. If you need more information on COVID-19, you can go to the financial support section of our hamilton.ca/coronavirus website and get all the information that you need there in terms of supports. And remember to shop local as much as you can from your local restaurants and local shops that are still open at 50% capacity. And on the restaurants, if you can pick up as when you're ordering in, as opposed to getting it delivered, that certainly saves the operator quite a significant amount of money. So the more that you can put into their pockets, the better off they're going to be as they struggle to manage their way through this pandemic as well. And of course, there are a lot of outdoor amenities available for you to enjoy, and we're keeping the skating rinks and local trails and outdoor spaces as accessible as possible. So for those that are looking to entertain themselves that they can't do it indoors, certainly there's lots of outdoor opportunities. And with this new snow, who knows? Sledding, skiing, sliding, snowball fights, etc., are always good for some family entertainment. So feel free to enjoy the great outdoors, and feel free to go out and get your vaccine if you haven't done so already. Thank you all for your participation. We'll see you next Monday, January the 24th at 3 p.m. for the next update. And remember, you can go to the hamilton.ca/coronavirus website for any additional information in terms of where you can get that vaccine. Stay safe, stay well, and look after one another, and we'll talk to you in about a week. Thank you.
Stand by, please.